So if you know the specific causative organism which is causing the bronchiectasis, you can specifically choose the antibiotic or anti-TB drug. Anti-TB drug. So that is why we have to do culture in all the patients. And the next time the patient may come with some other infection, some other bacteria. You should be very careful in choosing, because bronchiectasis, infection-related bronchiectasis, you have to give good antibiotics, specific antibiotics, sometimes high-end antibiotics for a longer time, more than 2 weeks sometimes. More than 2 weeks, sometimes 2 to 3 weeks, because it's a stubborn infection. Because the antibiotic penetration also is very difficult to the site of the problem, because there is no proper blood supply, there is no proper place for the antibiotic to penetrate into the infected area. So that's why the antibiotic delivery also is very, very low to the site of infection. That's why you have to give a good antibiotic, sometimes dual antibiotic, sometimes for longer duration. Sometimes for longer duration. So that is the treatment part. So coming to diagnosis, X-ray. X-ray is a very important, simple tool to diagnose bronchiectasis. But unfortunately, all bronchiectasis patients will not show. Many times it may be normal. The X-ray may be normal. If they show, what are the things? You may see some bronchiectasis changes in the lungs, or you may see sometimes what is the cause of this bronchitis. If there is a pneumonia. One second. Hello. నేను క్లాస్లో ఉన్నామా, తర్వాత చేయండి. Sorry. So X-ray chest, most of the time it may be normal. If you find some changes in the X-ray of bronchiectasis or associated, if there's a pneumonia or if there's a tumor, if there's a mass, if there's an abscess, you can also see sometimes. But many times it may be normal. Then you have to take the help of CT scan of the chest. Arbas, CT scan of the chest. In CT scan of the chest is the diagnostic. You cannot miss even a small bronchiectasis changes. I'll show you a couple of pictures of the CT scan of bronchiectasis. Bronchiectasis, the typical pattern is Trom track sign. Trom track. There's two Trom tracks, like two lines, linear lines. If the scan is cutting vertically, or if there's an end-on cutting, you will see like small holes in the lung. So I'll show you the picture. One second. Can you show me here? Which one you want to show? Show this. Show this.
You can draw also, sir, if you want.
Yeah. No. Next one. Next one. Show this. Yeah, you can see here. Here, you can see this is a Trom. This is very clear here. You can see this Trom track sign. Okay, that is one. Next, if you come here, you can see the hole. These are the end-on. There's a cut. The cut portion of the enlarged ectatic airways. Sometimes we call them as a honeycomb appearance, honeycombing. And tram tract, honeycombing, and tree in bud appearance also. Sometimes I can't see any tree in bud appearance. Also we can see. Can I have the next? Yeah, sometimes if the swelling is a big one, you can see something like this. As I was talking to you, the saccular enlargement. Saccular enlargement. So this is the one. These are bilateral changes are there. Here you can see a tram track here. This is a saccular enlargement. Next one. Yeah, this is the typical honeycomb, though it's looking very big. The entire right lung is gone, almost more than 50, 60% of the lung is has got holes. Actually, the bilateral disease, you can see how big it is. And these are all fibrotic changes here. And these are all the end-on cut view of the enlarged ectatic airways bronchus. Is it clear? Is it clear? Yes. Okay. Next one. Yeah, I think I'll show you the next pictures after some time. What is the time? Yeah. So that is the CT finding. That is the CT finding of bronchiectasis. Okay. Now, once you made a diagnosis, you have to treat. First, try to find out the cause and then treat. Treating most of the time there is an infection. Most of the times, only there are intervals between the infection. Patient may not need antibiotics, but when patient comes with symptoms like breathlessness, cough, sputum production, bronchodilators like your COPD and bronchial asthma, bronchodilators is used. Steroids also used because they're anti-inflammatories, and antibiotics. These are the cornerstone of the treatment. Bronchodilators, steroids, antibiotics. So as I told you, it's a permanent irreversible disease. You're not curing the patient's disease. You're only giving symptomatic treatment. If there's infection, you treat. If there's a bronchoconstriction, you treat. If there's a wheeze, you treat with bronchodilators. And many people will land into respiratory failure. Sometimes you may have to give oxygen. Sometimes you may have to put the patient on ventilator, depending on the extent of the lung damage, unilateral or bilateral. And most importantly, you have to give the physiotherapy, chest physiotherapy. Chest physiotherapy, postural drainage is very important because there's a permanent damage there. It is always a nidus for infection. Patient may come with infections again and again. So, chest physiotherapy, postural drainage. Postural drainage, depending on this site. Suppose there's an upper low bronchiectasis. So you have to ask the patient to just sit and cough, bending the head forward. Bending the head forward. Early morning, the sputum production is